This can't happen tomorrow.
Right.
Thank you so much, Miss Alia. I really appreciate it.
Oh, my pleasure.
Yeah. Speaking of warm drinks, let me take the tea.
So I think we're in a pretty good place to start. Mm-hmm. Yeah. Okay. Yeah, sure. Good. Hi, everyone. So good morning, good afternoon, good evening, wherever you're joining us from. You're welcome to the fourth day of the 2026 Nigeria Implementation Science Alliance Research Week. Today, we have a mosaic or a variety of implementation science experts in the room, and they'll be doing justice to the topic on equity and lived experience. And I'm going to introduce myself. I am Professor Tonya Onyeka. I am the Associate Director of Ivan Research Institute, and I will also introduce the moderator for today's program. Just permit me to share my screen and introduce her briefly. So today we will have Dr. Stephanie Bemere, who is an assistant professor at Duke Nursing and affiliate faculty at Duke Global Health Institute. She advances sickle cell care in low resource settings through implementation science, community engaged research, and health equity focused interventions across the Africa region. So I'd like to invite Dr. Ibemere to go ahead and moderate this session.
Thank you so much, Professor
Hey,
Onyeka.
Alia, so
I
cute
know,
over
Alia,
there.
look at this baby.
So cute.
So very, very cute. So very, very cute.
Hi.
Hi. So, good day, everyone. Welcome to day 4 of the NISA Research Week. Thank you very much, Prof, for the very kind introduction. Today's session, as we've said, is titled Equity and Lived Experience, Whose Evidence Counts, Centering Equity, Community Voice, and Lived Experience in Implementation. And so let me start first by introducing our speakers today. I have the great privilege of having the opportunity to moderate this session today, and I would like to start by speaking about Dr. Michelle Gouy. Dr. Michelle Gouy is a research fellow and public health physician at the Health and Social Care Unit of the School of Public Health and Preventative Medicine at Monash University. A significant focus of Dr. Goui's work is equitable implementation in health and social care settings, with a focus on how to operationalize the principle of equity, and she leads the internationally recognized program SEMPRE, which is strengthening implementation, practice, and research with equity, and is a co-founder of the EQUIP network. Next on our illustrious panel is Ms. Alia Griffiths, and she is a lived experience leader in health and medical research with Monash University's Health and Social Care Unit as well. Ms. Griffiths' work strengthens implementation practice by embedding equity, community expertise, and real-world context into research translation, supporting approaches that can meaningfully connect evidence with the communities it aims to serve. And last but certainly not least is Dr. John Okpanachi Oko. Dr. Oko is a seasoned public health professional and development expert with over 20 years of experience in HIV prevention, care, and treatment programs. He serves as principal investigator and chief of party at Caritas Nigeria, that is the Catholic Caritas Foundation of Nigeria, where he provides strategic leadership for major health and humanitarian initiatives, particularly in HIV and AIDS programs. So I welcome all of you today to our session, and I'm grateful that you are here. So this is a particularly important conversation for implementation science because it challenges one of our core assumptions. That is, evidence alone may not be enough. So increasingly, we're recognizing that whose evidence counts, how it is generated, and who defines it. It has a meaning, and that meaning is just as important as the evidence itself. So across global health and implementation research, there's growing recognition that equity itself cannot be an add-on or just a reporting category. It has to be embedded in how we design studies, how we engage communities, how we interpret the findings, and then translate that knowledge into action. So this includes elevating lived experience as a legitimate and essential form of expertise, not just an optional perspective that we tack on to the end. Today, we're privileged again to hear from this distinguished panel that will bring complementary perspectives from global implementation, co-production and intervention design, lived experience advocacy, and large-scale program implementation in Nigeria. So I encourage everyone that is here to engage deeply with today's discussion, not only because it's sort of like an academic exercise, but really to challenge ourselves as to how we currently define evidence, whose voices are centered, and how we will build more just and effective implementation systems. So that's a lot of big English. Let's get started, okay? So I'm going to ask the first question to Dr. Gui. Dr. Gui, you work extensively, in co-production and intervention mapping. And I'm wondering if you could share with all of us an example of where involving community members with lived experience fundamentally changed the design or the direction of an intervention.
Thanks very much, Stephanie, and thank you so much to Prof. Onyeka and Nisa for the invitation to be here today. It's really such an honor and a pleasure. So I really believe in involving community members, or as Alia, I'm sure, will explain, in our team, we refer to them as lived experience experts. And I think it's important to involve them as early on in our research as possible, so that you can, in fact, minimize the need for changes to the design or the direction of a program. And so in our own work, we build in lived experience expert feedback from the very beginning of the project, in that really early development stages, to inform the initial design and direction, so that we don't have to fundamentally change anything sort of halfway through or towards the end of a program. So Alia, who's also on the panel, I work really closely with Alia, and we have a really close partnership when it comes to the SEMPRE program, which is the program that we both work on at Monash University. And in fact, I really think of us as co-leads of the SEMPRE program, because we're often brainstorming and developing ideas together. Of course, Alia doesn't represent every single community member or lived experience expert, and we obviously seek out additional opinions and perspectives as well. But what I found working with Ali every day has really helped me think more broadly about the research that we do and the impact that our research can have, both positive but also negative. Um, and I value Ali's input just as much as any other member of our team. In fact, to be honest, probably more than other people within our team, because I think she brings in such an important critical perspective that we in academia and medicine really need to listen to more often. So one example I can give is a study that we're currently working on where we are looking to hear about different perspectives on equitable implementation across multiple different disciplines, health, social care, and education. Um, and by having Alia on the team, we have all agreed that as part of our study design, it would be really important to not only hear from the practitioners, so this is a qualitative study or a mixed method study, but also to be really engaging and listening to lived experience experts, so people who are receiving the services that we're exploring. And I think that by doing this work, we've added a whole new dimension to the research. I think it's a lot richer because of it, and I'm hoping that means that we won't be having to make changes down the track because we're already engaging with them and bringing that lived experience input in very early on into the whole process.
Thank you so much, Dr. Gui. It's as you said, I just learned a new word myself, lived experience expert. And so I will try to integrate that into my own speech. Speaking of lived experience, I would really like to hear from Ms. Griffiths, Ms. Alia, about your perspective as a lived experience advocate embedded in research teams like the one with Dr. Gui. What does meaningful involvement of community members actually look like in practice?
Thank you, Stephanie. And I think this session is a really wonderful start. I'm so incredibly grateful to be here and for you all to have me share a little bit more of this practice and what it can look like. I think to have a session with a lived experience focus is so incredibly impactful. So thank you. For me, meaningful involvement looks like listening, a real genuine willingness to learn, and sometimes that even might require some elements of unlearning too. Um, I want to start and really acknowledge that I am aware I'm so fortunate to exist in really strong spaces that are so passionate about the inclusion of lived experience. But I know that that's not everyone's reality. I think of some incredible researchers I've worked alongside, and they're the ones that are really happy to kind of decenter and deposition themselves at times. Those with a real willingness to learn, to acknowledge this duality of expertise, and there's a real strength to not feel intimidated by that. I see it as this most incredible spectrum of expertise. So ranging from scientific knowledges to this really rich community defined evidences. And we see this such rich and wonderful synergy when these ranges of expertise can not only coexist, but also support and strengthen each other. And Michelle really spoke beautifully about how well our practices engage in this constant willingness to learn and grow together in our practice. I'm really fortunate. I sit actually in quite a unique lived experience role where I'm really embedded in a research team. And the most incredible thing about this team, apart from the fact that they're all very wonderful, is that there's just this really silent strength within everyone and because of that, it's made me so I've never had to feel lesser or maybe like I don't belong in this really incredible academic and research world. You know, I live in my own body and I hear the things I say, and I know there must be some times where my team are going, what is happening? Like, and just this really big gap between scientific and community defined evidence. And, you know, never once has that been displayed to me. And especially coming from a non-academic background, I've never been in university. I come from the inequities we often work to remove. And the people I'm fortunate to work alongside really respect that and me. I think more broadly, there's some really simple ways this can be done. So when we're working with lived experience contributors, introducing ourselves by our first names and maybe a little bit more about who we are, beyond our titles. It's not uncommon where we see introductions and we have all these wonderful people with wonderful titles, and then we pan to our lived experience contributors and they're expected to introduce themselves by their first name and then potentially the worst thing that's ever happened to them. So it really just creates this unbalanced power dynamic from the start. I think back to the people who have really selfishly explained acronyms or haven't assumed knowledge around me. And I remember working alongside an incredible academic, and she would always just make sure there was a little bit of paper between us, and she would always write things down, so I never had to ask. I never had to put my hand up for not knowing. She would always have this amazing skill of being able to preempt these gaps, potential gaps. And quite similarly, there's so much power in asking questions that you probably know the answer to, but the lived experience contributors next to you might not know. And we really lose nothing by making sure everyone has a space to feel welcome and included. I know these things might seem so small, but they are so impactful and can really create such a safety for us to be able to exist in and feel really comfortable to contribute and share. And then I think the final thing would really be around honesty. I find it incredibly helpful. There will always be things that we can't do, changes that you potentially can't make, expectations that we can't reach. But if we've worked on the safety, these conversations and experiences will be so much easier when they will ultimately occur in our practice.
Gosh, this is really insightful information. You're making me remember my first day on campus and how everybody spoke in acronym, and I felt very, very much so on the outside. And it took years. There are still acronyms I'm learning, but nobody put a piece of paper between me and them for me to learn. That's such a great idea, such a human nature type response to supporting those around us and making sure everybody feels welcome. That's a beautiful, beautiful example. I think I'm going to walk around with that in my mind for weeks and figure out how to implement it. Well, because of my culture, I have to refer to you as Dr. Oko. But if we are to adopt our theme of today, it's to name you by your name, which is John, but I can't, it's hard for me. Culturally, I can do it. So Dr. Oko, I'm coming to you next.
Okay.
And I just want to know, you've had 2 decades of experience, sir, and that's in HIV program design and implementation in Nigeria, and I'm sure in many other places. I'm wondering how you have been able to bring the community voice in and allow it to influence HIV prevention and treatment strategies in the real world settings that you have been leading.
Thank you, Stephanie. And just to extend my appreciation to the organizers of the Visa 26 week for having me on day 4 of the week. So essentially, right, like you said, it's always not been like this. I remember at the beginning of our work in the early 20s, it was like HIV design and implementation was like a top-down approach, right? Strategies are developed and sent to implementers, and implementers go to communities and just implement and do what they have to do. But over the years, we've seen increasing stakeholder role for the community in the design and implementation of HIV care treatment program. The top-down approach has significantly reduced, and we're beginning to see communities get involved in the design and implementation of programs and activities that concern them. There's an increasing, and I'm sure, I mean, at the early years, because of the way HIV started, it was the role of the experts and the academics to be able to define and decide how activities are implemented in the community. But over the years, we've seen that increasing involvement of people living with HIV/AIDS in the design and implementation of their programs, because these people have, like my colleague panelists have said, these people have lived experience of what they've gone through and what they think is best for them. And we've seen that over the years, the involvement in the design and implementation of HIV programs in Nigeria and across the world have significantly shifted. And if we must succeed, one thing is key, right? The HIV program has since moved from where it used to be a centralized, clinic-based system to a decentralized, client-centered framework, and that significantly has brought in a lot of initiatives in the things that we've done. One key thing that and I've seen the community voice translate and bring in the HIV sector is that communities currently drive accountability in the HIV sector. And one particular initiative that we have used to lead that is the community-led program of monitoring. In community-led programming, the people affected and infected by the disease are involved in the monitoring of the disease. And they are trained persons across communities that look at issues of drug stockout, look at issues in gaps in service delivery, look at where services have been provided and do not meet the needs of the community. And over the years, we've seen that community-led monitoring has led to ensuring that there are significant, drugs are available, readily available in facilities. Now, it used to be beyond the fact that implementers are also responsible for this, because the people affected also look at this. They're able to channel and send their data real-time to the government and other implementers and ensure that issues of drugs shortage is averted in facilities. Additionally, they've also been able to work in such a way that beyond the traditional clinic hours, they've been able to advocate to ensure that as a result of community-led monitoring, to ensure that beyond the normal hours, patients and clients can access drugs other times, either after office hours, weekends, and all that, just to ensure that everybody can have access to drugs accordingly. And of course, issues of corruption. One of the major issues we've had in the third world is the issues of corruption. We've seen community-led monitoring reduce significant issues of corruption, from the resources provided to support interventions to ensuring that the resources are utilized for what they're meant for. Additionally, we've also seen the community voice impacting on the acceleration of optimal treatment and prevention modalities to clients. They have served as advocates to push the government and implementers, and of course donors, to ensure that what is best for them is what is available to them. I remember clearly, at the early stages, one of the drugs that was very harsh as part of the antiretroviral was efavirenz, as a result of advocacy from clients and from the community. A DTG-based regimen, which is more friendlier and easy for clients, have also been used. And then, of course, in terms of biomedical prevention, we've seen the introduction of longer-acting biomedical prevention drugs being introduced into the system as a result of advocacy and support from the patient. And additionally, they have been involved in trying to ensure that the initiative that started some time ago, U equals to U, undetectable equals to untransmittable. These clients have been involved in that campaign, and we've seen the quality of life of patients improving significantly. Another thing that we've also seen over the years, like I said at the beginning, treatment was in clinics. But as a result of push from the community, we've seen the decentralization of care from the community setting to the community. You know, where the patients are, we've been able to take services from hospitals to the community settings, and we've also been able to ensure that beyond traditional experts providing care and treatment services, counseling and prevention services to patients, we have increasingly used community-based organization, faith-based organization that are closer to the patients to actually provide these services. And it's really been key. Another important impact that the community voice has also led to, particularly in a place like Nigeria, where key population was criminalized and all that stuff, because of the push and the advocacy from the community, we've been able to see that care and treatment for key population has been decriminalized, and we've been able to customize care to people that are in that population to be able to provide services to them, from the initiation of the one-stop shops, where a member of the key population can go to a particular place and access care without stigma, discrimination, is able to, the person, prevention, treatment, and other services is provided in one location. And that has really been key to also help us. And additionally, the uptake of self-testing, for example, has been a major strategy that's also helped the members of the key population access care and link to treatment as soon as they can. You know, and of course, like I said initially, the implementation of differentiated service delivery is another strategy that have come up as a result of the involvement of the community in the design of our programs. Now, there are different models of care that reaches patients directly where they are, from the multi-month discrete patient-led groups and other models is taking care directly to where the patients live and closer to them, and also trying to reduce the structural barrier in terms of transportation and other issues that hitherto affected their care. So we've seen the community get involved in the design, and that's, rapidly changing the way we provide services to patients and clients around Nigeria. Thank you.
Sure. Thank you so much, sir. That's a comprehensive review and offers many different strategies to us as learners, as people who want to adopt this style of implementation science, or really adopt this as a norm in implementation science, right? And so I want to take a moment in line with the theme of our day today, and see if there is anyone who has a question that they would like to ask. I don't have anything on the Q&A, but if you do have something that you would like to ask, I believe you're able to put that in the Q&A, and we can address that live. And if not, in the time while we're waiting for questions to come up, what I would like to do is segue to Michelle. And so my audience members, please, we are waiting for you. There we go. We have one on the Q&A. So, okay, thank you so much, Victor Uka. I'm so
Can we allow him to unmute him and ask the question?
Yeah.
Okay, so let's find him where he is. Can you unmute Victor?
There he is.
Okay, I think you can. Can you? Yes. Victor, can you unmute?
Yeah, Professor Tonia, can you hear me?
Yes, I can. Go ahead.
Okay, so thank you so much for the insights so far, even though I dropped it on the Q&A, but I would like to also ask the question here. So I want to find out, how can implementation science researchers ensure that they capture all the cultural diversity nuances in the design of their interventions?
Victor, are you posing this to everyone?
Yes, I would like to get everyone's perspective on it.
Okay, so maybe we can start with Michelle.
Thanks, Victor. It's a great question, but I think a big question. Um, I guess my feeling is really that you need to bring in lived experience experts and people bringing all those different perspectives in right from the very beginning, so that that can all be addressed up front, as part of your planning process, and so it's not being addressed too late. But I think as part of that, it's really important to go through a very intentional and purposeful exploration of who needs to be involved. So going out into community, talking to people on the ground, really brainstorming through with your own team, but also then with your lived experience expert colleagues about who needs to be consulted, and really stepping through all the different groups, thinking about those intersectoral needs as well, and intersectional needs, because I think it's if without going through it in a really meaningful way, you're always going to forget someone. And I think that you then, once you have the people that you need to reach out to, then really make strong efforts to reach out to those people and being flexible to meet their needs to on how to get in touch with them. And I think it's a lot about being flexible and being really mindful. I think exactly the sort of things that Ali is talking about. So try and break down the hierarchy and really give them an opportunity to empower themselves and listen hard to what those lived experience experts have to say. And don't just listen to the loudest lived experience experts, but go and make sure that if you've identified someone who needs to be part of that, the input, then really seek those inputs. I can recommend, Victor, a paper written by colleagues of Alia and I, Mandy O'Connor et al. I might see if I can find the link and pop it into the chat. But so they've taken intervention mapping, which I think you're all familiar with. Oh, you might not all be familiar with, but it's a very well-known program design, implementation, and evaluation approach. And what they've done is gone through just the initial 4 steps, but co-designed with a whole lot of different practitioners and policymakers about how you embed equity into that. And a large part of that is looking, before you even start thinking about who should be involved and mapping that out in a really purposeful way.
Thank you. That's beautiful. Alia, do you have something you would like to add to support Victor?
Michelle has done a wonderful job speaking to this. I would just really highlight and emphasize the need to be really aware of program and place specifications. Something that we were really mindful, and this is an Australian lens when we set up about our practice, was that there are some groups in our communities that will have distrust of institutions. So, who is the best person to do that work? If people won't feel safe enough to come to us, are there other ways we could be capturing those voices? And that's where I was speaking about that depositioning of self, because sometimes it's okay to say, I'm not the best placed person to do this. So who can you be partnering with to learn from? Because there's a really richness and strength when we make ourselves available to capture that diversity of information. That cultural sensitivity is so important, but it will be so varied depending on where you are in the world and what you're doing. So I think it's really, to make it flourish, it needs to be really person-centered. And also really acknowledging that not one person can nor should speak for an entire group. So making sure that even though you've got a specific cohort in mind, you've got a diversity within that cohort. So even looking at, where they live, regionality, rurality, there's so many different barriers within that would benefit to hear from and strengthen and practice from.
And John, anything to add without repeating?
Yes, just to, thank you. Like Victor said, I think it's important to ensure that your community engagement starts early, and it shouldn't be just a one-off engagement. It should be a sustained engagement with the community that you are trying to bring the evidence-based intervention into. And of course, it's also important that, like the last panelist said, communities are not homogeneous, right? And there are different subgroups and subpopulations within the community. And for you to be able to capture and ensure that the needs and priorities of all members of the community is gotten, it's important that you try to be in reaching out to be as diversified as possible so that you can get as much information that will help in the design of your program. Thank you.
Yeah, and I just want to add, Victor, when you're thinking about this and trying to engage communities, understand that interventions often fail because we try to retrofit them to
Absolutely.
those subgroups, right? And so the line is each group is not a monolith, right? And so it's important to understand that your interventions may need to be revised, adapted, deconstructed, and rebuilt based on those subgroups. And so being flexible in your mind as a scientist, that is something that is real. And something that we must account for is very important. So I thank all of you for addressing that, because that can be a tough topic, a tough thing to address when you want to develop an intervention in the way that we have been taught to develop interventions. And so, Victor, I want you to know that Michelle put in the chat a link to the reference, and that's available to everyone if you would like to read about the use of intervention mapping to address this very issue. So, John had started talking about his experience in a specific, with a specific disease process and how, in HIV, there has historically been this stigma and how using or utilizing the knowledge and the power of the community has supported intervention development for that group of people and ensured that there hasn't been that we can address the stigma that comes from misunderstanding. And so, Michelle, I wanted to come back to you and talk to you about your work in obesity prevention and other public health interventions. I'm wondering, when it comes to this, how do you balance fidelity to evidence-based protocols with adaptation driven by community priorities and lived experience? How do you ensure that?
Thanks, Stephanie. Again, I think that, when obviously they're both really important. So fidelity to evidence-based protocols is critical for effectiveness. But as you just pointed out, and I think that we've all talked about, you need to adapt to the people that you are going to be working with or that you're developing the program for. And that has to be driven by the community priorities and lived experience. So I think that, if these evidence-based interventions are not implemented in a way that has impact or in a way that resonates with the people that you're implementing them for, or in particular for those who need it most, so that we know, particularly in public health, but across the whole of health and really many different settings, that there are always people who need a little bit of additional step up, and they're the people that we really need to make sure that we are serving. And if we're not doing that, then it doesn't matter how well we apply that intervention according with guidelines or according with evidence, then I still feel like that's a failure. And so drawing on what I said before, perhaps, if we have these multiple perspectives and lived experience experts involved in the process from the very beginning, then my hope is, and I do truly believe that it's correct, that you then have to have less adaptations and less trade-offs to be made at the implementation end. And Stephanie, I think that you said a really interesting thing too about now, sorry, and I think it was you, Stephanie, talking about the importance of, making sure that these things work for the different people and that you're working with the communities. And I think too often, though, that we are retrofitting things. And I think that we really need to be working out who is the most priority populations that we need to set up these programs for and really make their requirements front and center. We can't be all things to all people. And as much as we would like to be, I think that we can try. But I think there's definitely groups that we need to prioritize. So in terms of obesity prevention, I think that's a particular sort of public health mindset that we need to be in. I mean, we know that there's no magic bullet, so there's fidelity is important, but we also know that there's, multi-pronged approaches needed for obesity prevention. We know that there's important things that we need to do, like moving away from individual blame and obesity-related stigma. But I do think that because there's a little bit of multiple opportunities within obesity prevention, although we know what the sort of the fundamentals are that we need in terms of what to do with obesity prevention, I think there's actually many different ways to approach it. And I think this is true of many public health issues, because they're so varied and there's so many different components. There's definitely not just one answer. So although fidelity is important, I think that there's also flexibility, and I do think that this is something that's important in all of our work and our practice, to be flexible and not to have fixed thinking, but in particular when you're working with community. And so I think in public health and obesity prevention in particular, there's no excuse for not working with community. And I think that this also feeds into a systems approach that we should be taking for addressing issues like obesity prevention. I think that we've already mentioned that it's important to connect with diverse members of community. We need to think about societal attitudes, particularly when it becomes relating to obesity, because we need to tackle that weight stigma and weight bias. So obviously, we also need to include the input of people who are already living with overweight and obesity, to learn from their experiences. And, it's already been spoken about, but we do need to think about those different communities, the different perspectives. We need to think about areas of intersectionality. And as already has been said, we obviously need to try and speak to as many people as we can. Again, we can't do everything, but to remember that one representative of community is not going to represent the reviews of everybody. And the only other thing that I wanted to mention, and this is a little bit tangential, but I wanted to emphasize that if you are adapting programs, that just the benefits of having multiple perspectives and thinking about how to think about that. And so one example is some work that I did in obesity prevention, where I was looking at barriers and enablers for delivering preventive care, or specifically obesity prevention care in general practice, so in primary care. And of course, so I thinking about the general practice clinic as the setting. So of course I went and spoke to general practitioners, who are the main healthcare provider. But I also went and spoke to the people around them, and thinking about that socio-ecological approach, I think is really important in implementation. So talking to the general practice nurses who provide really important clinical support to general practitioners, and often in Australia at least, actually a source of a lot of that preventive care. But then I also talk to not just clinicians, but also the administrators of the clinic, because an important part of implementation of programs is going to be thinking about financial viability and the practical implications of providing different sorts of care and in clinics. So yeah, I guess I also encourage you all to think a little bit perhaps outside the box, or outside of what is done that you might see in literature already, and really think to yourself, who does this impact, and who do I need to talk to get that full picture?
Yeah, that's really it's funny that you mentioned that, because I think one of the hardest parts of doing this type of work is integrating everyone's voice. So I'm not gonna ask you that question now because I want to hear from John about dealing with the structures that exist that can sometimes be constricting. And so, Dr. John, you've worked in large-scale donor-funded programs like Access, supported by the United States Centers for Disease Control and Prevention. And so I'm wondering how you're able to integrate community priorities while still meeting the very, very strict performance metrics, accountability metrics, all the rules and regulations that come with doing research.
Okay, thank you, Stephanie. Yeah, true. So I work, Caritas is a faith-based organization. And one of the principles we have as part of the Catholic social teaching is the principle of subsidiarity. And what that simply says is that if there's something to be done, right, you ensure that who does that thing is at the lowest. If it's at the community level, ensure the community is doing what it's supposed to do. And if it's at the state level, at the implementers level. So because of that, a lot of times we are torn between the priorities and the needs of the donor versus the community we serve. And that's one issue we have encountered over the years. So in trying to do that, it's important that you find the balance between what is the need from the donor and what does the community need. Finding that balance is important to ensuring that you develop a meaningful, impactful, and sustainable program. Now, over the years, what we have done is our programming, we've tried to, on a regular basis from one project to the other, we try to ensure that our community engagement and entry is strong, right? We look at who are the key stakeholders in every project we implement, and we try to ensure that the key stakeholders, we engage with them and ensure that none is left out. So at the community level, who are the beneficiaries of the project, right? Is it the clients or other beneficiaries? And at the service provider level, we also ensure that these are also another layer that is close to the community. We ensure that their input is really considered. And then at the coordination and policy level, at the subnational units, the state governments, the ministries, departments, and agencies that are concerned with the disease entity or the program are also consulted. So we try to ensure that our community engagement is strong, and we look at 5 pillars, essentially. Like I said earlier, you want to ensure that your community entry and engagement is early and is sustained. It's not just a one-off thing. You try to ensure that over the course from design to implementation, the community is greatly involved, and it will help you to be able to hear what the community is saying, feel what the community is feeling, and also make you adapt and make changes accordingly. And then secondly, we also want to be, you try to examine and look at what are the past historic relationship between the community that you're intervening in and our past mistakes, and try to, I think it was Michelle that said, there are power imbalances in the community, right? Who are those that are most important? Who are those that will influence things? Ensure that the power imbalances are handled accordingly, and that will also help you in the design and implementation of your project. And then, of course, you also want to ensure that if you are bringing in a new evidence, a new intervention to the community, ensure that they are involved in the co-create, they are part of the design. You do not leave them out. In that way, you can ensure that they are carried along. And of course, the issue of capacity, we cannot be overemphasized, right? You try to ensure that from the people that will leave the experience to the providers, to others, their capacity is to ensure that the intervention is done. And finally, you also want to ensure that continue to monitor your interventions, your partnership with the community to see if there are changes that need to be made, and it is made accordingly. In some of the programs we have implemented, as part of our continuous quality improvement strategy, we conduct on a quarterly basis the patient satisfaction survey. And through the patient satisfaction survey, we have over the years, made some changes to our programming, because from the patient satisfaction survey, patients tell you what are the issues with their program, what are the current barriers they are going through, what do they want you to change, and that has helped us significantly. And then we also engage the service providers, the state stakeholders on a semi-annual basis in our partners forum, where we discuss performance, discuss challenges, discuss issues on the program. And that has also helped us to ensure that where there are gaps in our program, those gaps are closed. And if we need to change any part of the program, those things are changed to ensure that the communities that we serve are the ones that are benefiting the most from our program. Thank you.
Thank you so much. Thank you so much. It's what I heard from you, and I'd like to just address once again, is this idea that just because the project is finished, it doesn't mean that you leave your community partners alone, right?
Absolutely.
They are part of the ongoing work. Money can finish, because it always will. But to show that you really actually value what comes from the community, they remain with you. They're part of your team, right?
Absolutely.
Yeah, so I appreciate that. Now, I would like to go to Alia and ask you this. What we're hearing about is how to make sure the voice of a lived experience expert is included and the communities that they come from. But I'm wondering, where do you most often see research teams unintentionally or maybe intentionally exclude or dilute lived experience input? Is it at the stage of study design, data collection, and like where do you see that happening?
I think what I found is this is really unique and individualized for depending on who's there. And I would often break it down in potential barrier silos. So, and I think we could either break them down to either individual or systemic. If we were to break this down, what it looks like from an individual lens, I would say that with individuals, there are more these feelings of unsure of how to do this work well. Usually what I find, it's not a personal or an intentional unwillingness to include the voice of lived experience, but more so not wanting to do it wrong. And I don't think there's anything wrong with that. I think it's a real joy when we can be passionate about our work and wanting to do it really well. What I just like about that is where you see these really passionate, incredible researchers kind of get stuck in this place of how to start. I would also say this practice takes a little bit of getting used to. I know I've personally sat in some lived experience spaces with some very passionate end users or contributors, and I know that it can be really confronting. People wanting to share usually come to this from a lived experience, which often stems from discomfort, unfortunately. And so I think from that individual lens, we need to get really comfortable as researchers, academics, to lean in and to sit in that discomfort. I know I really like to remind researchers that while you are working in this area, your lived experience experts living in it, and that just doesn't occur in business hours, unfortunately. And I've been really fortunate as a lived experience contributor to exist or be around a lot of research projects. And I don't know about you, but I can't really recall a time where it's been a really, joyous research project, like what's your favorite tropical holiday destination or ice cream flavors? Unfortunately, the areas that are funded are ones that are often really complex and really heavy. And I think what you'll find from your lived experience experts is that they're sharing this real and quite often vulnerable experiences and just how hard it can be at times to sit in that. So I find actually discomfort can be a barrier that leads to this kind of, in a way, unconscious barrier. And that's just simply coming from not knowing how to navigate that. So it's sometimes easier to just not do the practice. I think there's also another element of, well, how can they contribute? I know in our work, and I hope to get to a little bit later in our session, but we have a lived experience advisory group called the Village Network. And I know in this practice, we've got national contributors all over Australia with very varied backgrounds and experiences. We work with parents and carers of 0 to 17-year-olds and how we can embed equity in research. We sit in the SEMPRE body of work. And one of the ways that we always make sure that we're not intentionally doing that is we always provide all opportunities as opt-in. I really see it as it's not my place to gatekeep what someone may or may not be interested in. Really acknowledging that in a lived experience space, a lot of us have come from these really non-traditional education pathways. So it's not necessarily that we don't want to do the work and we don't want to contribute. It's that we've never really had the opportunity to learn how to do it. So I always try to provide these as learning opportunities. If no one wants to, then no one wants to, and that's absolutely fine. But it's their choice to make. We haven't, made any exclusionary practices. And I remember for me as a lived experience contributor, people telling me about different things that are, boring or frustrating. And I know when it's daily practice, it can be. There are these elements of research that just are really bothersome. But for me, it was these really amazing learnings that I would have never got access to otherwise. So for me, it's how can I strengthen my practice as a lived experience contributor to support your research, because the areas I contribute to are ones that have impacted me or will impact my family or the communities I represent. And I think this way of practice, it's really good because it's letting people choose. You let them determine what they think is of interest and is not. And I think we talk about equity, but these are really small ways we can embed equity in practice. And that by excluding, we don't exclude, we offer. And then I think if we're to look at systems too, so like I said, I think there's two elements to what can exclude people. And I think if we look at the systemic barriers, it could be around things we've just spoken about as well, but looking at funding, I think we need to acknowledge that very much as the very large elephant in the room, that we all have parameters that you need to work within. Sometimes it's hard to get your own work funded, let alone to ensure that you can properly remunerate or recognise contributors and the voice of lived experience. And I feel that's a really common way that the lead voice is often diluted, and systems and structures don't often support us through the entire research life cycle. Oh, sorry. One of the things we operate is life-friendly spaces. It's nearly 2 o'clock in the morning in Australia, and my 1-year-old, of course, has chosen the time to wake up now. So my co-presenter is Harper. We're very authentic with the ways we operate in this space. No problem. But thank you. And yeah, so I was touching on research life cycles. So, and I think just being aware of that is a really good start and awareness to have. So when you're looking at funding, could you factor it to cover the entirety of a research life cycle? And really avoiding what elements of research might be of interest or disinterest to lived experience contributors, really allowing them to be in control of their contributions. And then, of course, there's other general apprehensions, so around ethics. And I really love that this conversation came up organically, that, our communities exist outside of this. Because when we do get caught up in conversations around, when can I engage with community? When can I engage with community? We really need to adjust our practice. And is this purely transactional? And then is that an equitable relationship? If we're only going to them to these monetary transactions, what is that saying about our practice? And I'm really mindful that, most researchers, you're in an area of work that you're passionate about, that you exist in these spaces for quite long times. So how can you be existing in these spaces with your community, with your cohorts? How can you be listening and learning? And can this ability to listen support research and practice from the outset? So before we even get to, you know, funding and ethics, before an idea is even fully formed, can we not be truly striving for equitable practice from the very outset, and to really allow ourselves to be challenged or encouraged and pushed? And I think, you know, the other barrier I just want to touch on would be timing, and really mindful that these things can go so quickly, but also so slowly. I know I came from a crisis background, and then entering this work, one of the first things was explained to me about how long funding can take to not only submit, but then be approved, and then if that doesn't happen. So I think really being clear on timeframes as well, really providing our lived experiences contributors awarenesses around this, and that there might be delays. And then there might be really quick timeframes we need to get to. So I think there are some really mindful things to be aware of, and especially when timeframes are competing, we might not be able to embed the equitable practices that we'd like, or the life-friendly spaces we need for our lived experiences contributors. But if we can have that relationship from the start and really set up expectations, really set up a safe and honest relationship, I think that will help to avoid that dilution of lived experience contribution.
Well, this is really, really, really important, and I like how you put it. And I think John mentioned this idea of capacity building. Capacity building is not only a term we use to develop someone in their, in our space, healthcare skill, but it's also something that you can use to build your skill as a researcher and how to engage with people. But then also help our community, our lived experience experts understand, as you said, Alia, what does it mean to submit a grant? Even we sometimes are surprised by the process and how intensive and extensive it can be. And then you do all the work, as you said, and sometimes you don't get funded. And so what does that really mean? So I appreciate the connections that we're making here sort of organically about this process. John, there was a question that was asked of us by Abdullah Ibrahim. I'm not sure if we are able to get Abdullah to ask their question on their own. Ikenna or Professor Onyeka, I don't know if we're able to do that, or I can just ask it aloud. I may just go with that. So first of all, there was thanks for the presentation. And the question was, I would like to ask, in this same theme, what are the barriers to conducting research on lived experiences among patients with chronic diseases in low to middle income countries? And if you have any suggestions on how to address those barriers. And I think we're talking about it in general right now, but if you have any other specific barriers that you have encountered working in LMIC contexts and how you overcame them, I think that would be a great thing to add to the conversation.
Thank you. So essentially, over the years, one of the things that we have noticed and is now, first, if the people, the community is not, those with the lived experience are not involved in your design of the research. Now, the issue of trust comes in, and it's important to them a lot of times, right? So for me, so if you are designing a research, the involvement of the people you're going to work with is key. So ensure that you build trust and ensure that the people are involved in the research. Another major challenge in a resource-limited setting is the issue of funding for the research, right? Unfortunately, we don't have, if you're not getting funding from international organizations, there are limited funding available for researchers in country, and that for me it's a major barrier to because that's the only way you can do a representative research across multiple locations and all that, so ensure that your research is not speaking to a particular location, but can speak to either a region or the country. So funding is a major problem for researchers in limited setting. And then the capacity for research, thanks to NISA in Nigeria, and NISA is working with a lot of people and young researchers to be able to build the capacity for research. That is one major barrier to people are interested in it, but in research, but do they have the capacity to ensure that this is done? For me, those are three key barriers that, if they are circumvented, I mean, low, medium countries can explode as far as their research is concerned.
Absolutely, absolutely. I have to second that. I'm going to take us somewhere that's a little bit different, okay? And we've described this term equity in some way, shape, or form. And this is a question for everyone. I'm wondering specifically about how or in what way you have been able to operationalize the term equity in your research. And how did you get beyond this idea of disaggregated outcomes in defining equity? Anybody is welcome to take that question.
I can start if you like, Stephanie. So I think that you've hit on such an important thing, and we talk a lot about operationalizing equity and how do you go about doing that. I think that we find in Australia, but I'm sure it's not just in Australia, but equity is often a principle that is cited in lots of different policy documents, strategies. I think in public health in particular, we talk a lot about equity, and I think we all want to think that we're doing it, but we don't really think about how that comes through in our research. We actually just completed, or a year or so ago, completed a scoping study where we looked at what we called processes for equitable implementation. So we did a really large scoping review. We had initially 14,000 different papers across multiple different disciplines. And we actually came up with we found 500 different examples, or more than 500 different examples of how people operationalize equity in their work. And if I can just tell you some of the themes, but then maybe I can give you some examples of the ways that it was done. So there were 7 main themes, and these are also built off some work that an amazing researcher called Alison Metz has done around equitable implementation. But things that I think that have come up in the discussion so far. So things like foster trusting relationships is critical. So it takes time. You have to build the relationships with the people that you're working with your lived experience experts, with your community. And I think Dr. John made such a good point that it has to, this is an ongoing relationship. This is not just something you click in and out on depending on whether you got funding. This is something that you maintain throughout, regardless. And I think that gives an indication that you're really committed to that community, and it builds that trust. Dismantling the top-down approaches and redistributing powers. So, co-creation and co-production that we've been talking about, that's such an important part of dismantling top-down approaches. Investing with intention. So really putting your money where your mouth is. And, we've spoken already about the importance of funding and having the right funding. So if you're particularly funders, to get them to prioritize lived experience research. Or if you're putting together a budget for a grant, and Alia and I have definitely done this, we always budget for making sure that we can have lived experience people consulting into the project. And I think maybe one thing that we haven't said explicitly is it's really important to remunerate lived experience experts appropriately too. We can't just expect them to do it all free of charge. We have to acknowledge and recognize their experience and their expertise, and respect and value community defined evidence. So not just seeking it, but going beyond that tokenistic talking to people, but actually using that input that they provide. Obviously tailoring according to context. Really thinking outside the box and broadening perspectives and approaches outside practice norms, and using strengths and values approaches. And I think that's actually one thing that is really important that we see in our work that we'd like to do more of, but making sure, that you're using strengths-based language, so not talking about all the terrible things that have happened to people, but really drawing on community strengths. Making sure that you're using plain language to some of the points that Alia made before. Make sure that you're open and not assuming that people have particular types of knowledge, so that you can help people understand and bring them along with that journey. And again, just reducing that hierarchy and empowering people to provide the input that they need to have. When you're communicating with community, ask them how do they want to be referred to, or ask them what makes sense, what are the issues that they want to have. And this is particularly relevant in a country like Australia where we have a lot of cultural diversity, but if we have graphics or language, then make sure that the graphics, for example, reflect the population that we're talking to. So it has to make sense to them, and that's something again that we can work with lived experience. So that's just maybe a few things to think about from a research point of view.
Thank you. I'm going to come back to you about the SEMPRA network and here so we can hear more about it. But Alia, any thoughts about how one defines equity in this work?
We, in my work, so I was really fortunate to join the Health and Social Care Unit as a lived experience contributor. Helen Skouteris is an amazing advocate for how we can strengthen the practice of this work. And she has always really subscribed to the notion of nothing about us without us, and really gave back to the community and said, what do you need to support this strengthening the inclusion of lived experience? So from that, like I said, we were able to create a national network of lived experience contributors. And we were so intentional with how we did that, and really aiming to embed equity through all our elements of practice. Looking, like I said, we were parents and carers of 0 to 17-year-olds, and even really mindful of including carers in that definition. We look at raising children. There's so many different ways that can be done. It's not these traditional two-parent home. So we really went, well, who is involved in that? If we want to look at shaping outcomes, be it education, health, social care, we need to include a holistic family unit, really equitable practices. And these seeming so small decisions, but they were so intentional and thought out at all our aspects and elements. We've, worked so hard to remove those barriers. And I find so much of how I exist is kind of a conduit between making sure research makes sense to our lived experience contributors, and the lived experience translation also occurs to research. So it's this really nice balance of being able to just sit and listen and absorb and make sure that's expressed, so no one is made to feel lesser. And that's our research partners too. Like, we have such a rich, this really strong community-defined evidence and knowledges that wouldn't have been gathered any other way. So how can we champion that? I find looking at equitable practices, so much of what I do is just allowing my work to be centered on the person in front of me. So we have a monthly meeting. And again, equitable, we don't meet in July or December because no parent will be available at either of those times. In Australia, it's our summer. So, we have quite an extended school holiday. So even setting up our meetings, but really just going, how what do you need from me to be the best you possible? And some of my our members really like information in advance, so we provide summaries in advance. Some like to have really great conversations when we meet. Others like time to think and then get it back to me. Some people send me voice notes, some people send me text messages, some people send me emails. So there's all these flexibilities that, and I really understand as a researcher the pressure it can take. But if we talk about equity, these are these simple things that, and I say simple, but they're not. They are time consuming, but they're these practices that we can start adapting, because by really allowing us to go, you know, what do you need to be the best you can be? You will get so much richer and more impactful information from your contributors, and I think there's such a benefit and a power within that. And so we've just been really intentional with everything we do of going and really acknowledging, even in, like, I'm glad Michelle touched on the recognition and remuneration, because, you know, we make sure their time is really appreciated. But, you know, if you don't have capacity to fund, is it something like, are you doing authorship that you can invite your people to contribute to? Is there, what other elements that they can still be recognized? We also send out thank you certificates every year. So people can put it in resumes, they can really strengthen, but they can also be acknowledged to go, okay, this place that I'm sharing from of such vulnerability, of discomfort, is actually being used and adjusted and implemented somewhere, and they can see this real change in real time. So yeah, there's just so many wonderful aspects that we can be starting to embed now, that you look at that research translation gaps that's so long, but by having this equity involved at the start, by having this voice of lived experience, we can see this real-time change, and we can see this real-time data collection that otherwise we wouldn't be getting, because we've got the people living in the gaps going, this is a great idea, but, and it's not to say that the practice isn't wrong, but it's like, how do we strengthen it so the people who need the result will actually be able to access it?
Yeah, you've sort of been dancing in all the areas I wanted to ask about, so this is great. I see Professor Ezenoluwa's hand is raised. Before I go to John, maybe Prof, would you like to ask your question?
So I just I just want to take a chance to thank Michelle and Leah, and people may not recognize it, but they joined this meeting at 1 a.m. in the morning. I think it's important to know that they are talking to you as if they are supposed to be awake. No, they are supposed to be sleeping. But it has been, to me, I have always told them that that is one of the area they practice what they preach, which is equity. So sometimes they have this meeting at middle of the night, sometimes in the morning for them, at middle of the night for us. But in that collaboration alone, they have found equity to do that. So I just wanted to thank you. The thing I wanted to add to what you just described in terms of equity and how you operationalize it is for people to really understand the part that even in the beginning, from the selection of sites for your study, you start to operationalize that. Just by that alone, you can disenfranchise some people, you can limit some people, you can select the site based on your own convenience. These are places I can get to. These are places that are in Abuja. We don't actually have a site in Abuja for that reason, because people who are in Abuja really have a different environment. You could as well classify them as people in New York, because the problems are not the same of actually where the majority of the people live. We try to do our study in all the 6 regions of the country, again, for that reason, trying to bring that understanding that there are regional differences, that some of them that are contextual can be affected by culture, language, economic environment of those regions. So when we really want to do study that we want to say this is a Nigerian study, we like to have that diversity involvement. And I think that's one of the ways where you can actually start to talk about equity as you start the development. Thank you.
Thank you very much, Prof. And with that, I will go to John. Any thoughts about how you have been able to define equity in the work that you're doing?
So thank you. So if I want to look at it from the perspective of health, right, equity in health simply means you ensuring that everyone has a fair and just opportunity to attain the highest level of health, right? In trying to do that, one of the things we focused on is how can we remove systemic obstacles, such as poverty, discrimination, lack of access to health facilities, and all that from our programming. And so looking at it from three core pillars, right, as far as equity is concerned, we try to ensure fair allocation of resources. Now, resources should be allocated to communities or individuals based on their level of vulnerability, not equality, right? You don't allocate resources because it has to be equal based on everybody, but what is their level of vulnerability and what is their need and priority? So resources needs to be allocated fairly. Then additionally, how can you ensure that the social determinants of health, right, are addressed accordingly, right? Where people live, right? Where they work, their age, and all that impacts significantly on health outcomes. And in dealing with equity, you want to be able to address those areas to ensure that where those social determinants can, and then thirdly, you also talk, okay, what are the barriers to accessing health or to ensuring is there discrimination? Are there prejudices in providing? Do they have issues in the facilities they go to? And ensuring that you do this will significantly impact on the health outcomes of the communities and the people you serve. And if you bring this into perspective, like we've said a couple of times, right? When the people, the community is involved in your design of the program, significantly, it brings about equity because they're able to tell you, this is where we have the problem, this is how we want the problem solved, and they help you in the design of your program, your health programs, and it actually ensures equity in programming. Thank you.
If I may, there's something that we have been saying, and I've been trying to avoid going there, but I have to go there because you guys took me there. Dr. John, you mentioned Catholic social teaching. I am a graduate of Xavier University. It's a Jesuit university. And so I'm very familiar with Catholic social teaching, and the idea of social justice and how that connects with equity is what drives my own research program. And I want to share an image with you all. I'm taking us somewhere. Just bear with me. And I just, in what you're describing, we asked the question of how do you define equity and doing research in this way. But there's something that you all are describing that I actually think is one step beyond equity, and I actually think it might be justice. And so in talking about equity, most of the time when we say this, we're talking about making sure each person has the things that they need for themselves to be able to participate. We've talked about building capacity of each person who wants to be involved in research. We've talked about making sure that both sides of the table are present at the beginning of the research process. But even that statement alone, I think, pushes us to this idea that the system, as we've described, that can sometimes be rather strict, we ourselves are actually pushing the needle towards justice. That is making the system itself work for us. And so I want to invite us to applaud you all in the fact that you might actually be taking us a step beyond equity and instead actually addressing the crux of Catholic social teaching, which is to bring about justice in all that we do. And I do think this idea of health and advancing health and public health promotion is aiming to do that. And as a nurse, I took an oath to provide justice-based, equity-based care to people living with different chronic conditions. So I just want to commend you all that you might actually be taking us even further than we imagined as researchers and lived experience experts. So thank you for sharing your thoughts. The next question I want to ask you all, and again, I call to our audience, if you have questions, please feel free to put those in the Q&A and we will answer those. But the question that I have now is this idea that there are so many frameworks, right? We have frameworks and frameworks and frameworks. How do you co-design? How do you embed equity? But then we still hear that communities are often reporting not being heard, right? So what needs to change? And that's kind of why I wanted to show that image. What needs to change in how institutions define expertise for lived experience to truly influence decision making. And Alia, you're our lived experience expert. Why don't you start?
I would love to. And I thank you for just really appreciating this work and what we're doing. I know it's something, it's 2:22 in the morning and Michelle and I are both here, and I know I was worried if I'd make sense, but I found myself answering a question earlier so passionate and going, okay, keep on time, like keep it reined in. So it's just such a passion and a delight to be here and to have such an interest in this. So I really want to acknowledge that. And I think, sorry, 1 second, my sidekick needed me. I think reflecting on frameworks and how we can really support this expertise, okay, is really about a genuine respect and understanding of community-defined evidence. And I think by including the voices of lived experience, and especially if we're to look at it from an equity lens, these lived experiences are probably speaking from very real, clear and tangible gaps. And I love that you've introduced us to kind of take people on a journey. So I would like to do this now, but think, if you will, of a map maker, someone making a map, and please bear with me for this. And if we look at it from a very geographical lens and really consider the tangible elements needed. So, we could consider things like legends, locations, data points. These things that can be captured really clearly and really defined. But then also a consideration that sometimes areas aren't really well known. They might not be frequented. Maybe common tools like Google Earth can't always accurately capture a potential rough mountainside. Maybe there's some unstable terrain. And I don't know about you, but I know if I were to visit somewhere like that, I would really prefer a document that had been shared with the people living there that could tell me, if roads had been washed away, what paths might flood. And I think there's a real and tangible strength for the inclusion of lived experience. And it's not in any way to take away from scientific evidence or structures. Instead, it's to really strengthen the richness of both of these practices. And I think it's a true art when these two knowledges can combine. And I truly believe really impactful things can come from that. I would truly like to see changes around really acknowledging the benefits of community-defined evidence, which I think in this space is really strong, but how can we continue to strengthen that practice? And how can we meaningfully include this? And I think sometimes the really understanding that, potentially our writing styles might not be, say, academic, but our messages can still be really, really strong. So how do we have that evidence championed? I know, and I've spoken about it a lot, but I think it's really important because we do often share from places of discomfort. And I think when we speak about when systems haven't always worked or potentially haven't always gotten it right, I think it's really hard for big structures, for systems to sit with that and to go, maybe we need to rethink how we do funding. And I think that can be really hard, to really consider that, you might have been complicit in not maybe creating inequities, but not creating practices that can remove them. And I think that's a really hard space to sit in. And I know I've spoken a bit about our work at the Village, but, we really aim to engage, the lived experience voice of me and our other contributors throughout the entire life cycle of a research project. Michelle and I say I, but Michelle has done such amazing groundwork in including the voice of lived experience in these life cycles, that's so uncommon and unheard of. And, we include our LEs, our lived experience experts, in publications, in co-design, in evaluation. And there's so much work that goes into this and these really non-traditional workings that I think is really important to highlight too. If we look at frameworks, we need to look at existing ones, but also gaps, and how this work might actually be being done on the ground in equitable structures. And it's really about, I know we work really hard on creating safe spaces where everyone feels comfortable to contribute. And that's what we went in when we created our work. It's with that equity mindset about how do we not only create a space that people will want to come to, but more importantly, want to come back to. what are those barriers that exist that we can be removing, or really like at least minimizing? There's structures that will always exist, but what can we be doing in that space? And really mindful of creating structures where people are encouraged to contribute, like I said, in the ways that are comfortable to them. And I don't want to simplify that, but I just really think it's important to talk about these simple steps that we can be embedding equity in everyday practice. And really more than that, striving for real relationships. I know we've had members from the other sides of the country come to where we are to reach out because they want to have these relationships in the middle of another trip, where I know I make a point when I go to conferences in other locations that I reach out to our members there to see if they want to connect, because that's what matters. They like to, we want to be seen as people, we want to be individuals, we want to be more than a funding structure. So there's really simple ways we can do that. And, there's some other steps that we've embedded into our practice around simple things like evaluations. We do a monthly evaluation after we meet. And we're really strategic around, or not strategic, more mindful around whose voice we wanted to evaluate. And for us in this space, it was our lived experience contributors, because, funding is very important, I think, can exist without it. But if what we're funding isn't authentic, if it's not safe, if it's not real, people won't come and we won't get that richness of knowledge. And I think if we're to look to a change, if we want to look at equity or even move towards justice, these are these small actionable steps that we can be implementing now.
Well, that's beautiful, Alia. Thank you so much. And I wanted to make sure that people understood what the village is that Alia is mentioning. It's the valued individuals living and learning about growing equity. That is the village. Maybe Michelle, you could talk to us about the SEMPR network and maybe how you guys have been able to define expertise in the network or in the EQIP network too.
Yeah. So the EQIP network, thanks, Stephanie, is a network. It's an international network. EQIP stands for the Equitable Implementation Research and Practice Network. So we purposely have steered away from calling it implementation science. And really, again, I think that as academics, we do a little bit of siloing, I think, of knowledge and a little bit of gatekeeping, maybe not a little bit, a lot of gatekeeping of knowledge sometimes. And there's a little bit of self-preservation perhaps goes into that, but I think that, a lot of what we've spoken about today is we need to be more open and be sharing that knowledge and acknowledging different sorts of knowledge and how important that is. And so with the EQIP network, this is a global collective, and what we're trying to do is really reorientate implementation research and practice away from that siloed approach, maybe away from a Western Eurocentric approach, and really making sure that we're not just listening to one perspective in academia, as I think that we tend to do, maybe not intentionally, but that's just the way that things are at the moment. But this network's been founded by early and mid-career practitioners, researchers and advocates, and lived experience experts. Alia sits on that steering committee, as well as I do, as well as Professor Onyeka. We have a great number of people who are involved and some really amazing people. We launched last year in October, and the EQIP network has already grown to include almost 300 members from over 110 institutions in 27 countries. So I think that already shows that there's a real appetite and interest for learning about how to do equity, to your point, Stephanie. So the vision of the EQIP network is to advance global health equity through transformative implementation, research and practice. We are really passionate about fostering collaboration and building capacity and breaking down those silos with an explicit focus on equity. I think one of the things that we do is we really call it out and talk about it a lot. Our mission is to embed equity in implementation, research, and practice by equipping the next generation of leaders, empowering communities, and dismantling, as I said, those disciplinary, geographic, political, cultural, and institutional silos that can really hinder progress. We have a network of early and mid-career researchers, but it's not just researchers, it's practitioners, it's policymakers, it's community members. So again, trying to take that full systems view, and we're empowered by amazing senior mentors. We at the moment, so after launch in October last year, this year we're really busy trying to grow the network to consolidate what we're doing and start to bring some of those activities and tools to our members. We are holding webinars. We're going to have our first networking group session start up, and we're also building an equitable implementation toolkit. And one of the things is that we're trying to do, again, living that equity, walking the talk. So this is it's a free network. It's available to anyone to join. Even though we talk about early and mid-career people, it's actually open to anybody. We're not going to knock anyone back. And we're really keen to get people involved. So actually the last couple of months we've spent trying to get people involved in all the various different working groups so that our members are involved in directly contributing to the work that we're producing, and we'll be doing some co-production ourselves, even within our own network. I have got a slide here, which I probably should have put up, Stephanie, sorry, while I was talking, but maybe I'll just quickly show it now, if that's okay. So if anyone's interested in joining the Equip Network, we would love to have you as part of our group, and just trying to, there we go. So hopefully you can see that. So you can use the QR code for those of you who may be looking at it on a computer and can use a QR code with your phone perhaps. But I'll also put the link into, oh, sorry, now you're seeing the wrong slide, aren't you?
Oh, we're seeing the slide with the QR code.
Oh, great. But I'll also put the link in the chat as well for anyone who wants to look at our webpage and read a little bit more about the Equip Network, and also, of course, the link on how to join if you would like to do that.
Perfect.
Stephanie, can I just, while we are, since I'm sharing screens, and
Yeah.
you went into that, you showed that lovely picture with the justice at the end, I mean, as part of it. Can I just show you a slide that I like to show?
Sure.
Which hopefully you can see that equality versus equity.
Not
because
yet. Not yet. You may have to reshare and share
might have
again.
to reshare. I just wanted to, because I think a lot of the things that we're talking about are how do we make change, and how do we make how do we create these sort of systems changes for justice? And for me, it's again coming back to what you said previously around operationalizing equity and how do we do it. And I think a lot of people don't know how to do it. A bit like what Alia said, we want to engage with lived experience experts, but sometimes we don't know how to do it. And I feel like that's also an issue around equity. And so hopefully you can see my slide here. And again, this is a similar picture to the one that you presented, Stephanie. This is just equality and equity. And John before read out or explained the definition of equity. And we know the WHO, for example, we often think about it in terms of outcomes, having this equity outcome where people can see over the fence and watch the sport. But I think the way that the other bit that we talk less about is that equity is not only an outcome, but it's also a process. And that's the bit, I guess, that I think that we're really talking about today in this webinar is the process through co-production and engaging with lived experience experts. And I guess that's the bit that I wanted to really encourage people to think about, because I think that's how we start to make these systems changes, make it more possible for this process of equity to occur, which we hope then will lead naturally into outcomes of equity.
Beautiful, beautiful. So Dr. John, I have to hear from you, So how do we do this? How do we take all these frameworks that exist and ensure that we're pushing our institutions on how they define expertise? Any thoughts on that? What have you done? Any example that you've done?
Well, so for me, what I'd like to say here is, based on practice, we know that when you're talking about lived experience versus academic or people with the academic expertise, they bring the same value to the table, right? You don't look at the academic or the people with the expertise and think that they are the most important as far as designing programs and all that is concerned. So both persons or both groups bring the same value to the table. And you said something that I think it's important that we take note of. Despite all the frameworks and all the things that are available, sometimes the communities are still shouting and not getting their voice heard. And sometimes what I think that happens is we are actually practicing tokenism instead of actually inclusion of the people in what we do, right? When you bring somebody to the table and you're not giving them the required power to be able to express their voice and to ensure their voice is heard, and it's also, imputed in what you're doing, then essentially what you're doing is tokenism. You're not giving them the right power to do. And I think what we've done in our programs in the past is to ensure that if you are involving people, if you are bringing the community to the table, their voice is important. Their voice may not be the loudest in the room, right? But it's important that it is heard and it is considered in what you do, so that in designing or redesigning your programs, what they're saying is considered. So that's what I'd like to say at this point. Thank you.
Yeah, thank you so much. Yeah, I think that there's something important here that I'm hearing, which is that any person who has something to say about the topic at hand should be at the table at the beginning.
Yes.
And in the work that we do, there's ways to acknowledge that could be remuneration, but that could be other currency, right? So for us as academics, that's published papers, that's going to conferences and being the one that presents at the conference. Or maybe that is you're a co-investigator on this project. It can look many different ways, but the importance is that, as the song from Hamilton says, you want to be in the room where it happens. You're the one who is in the room when the decisions are being made, and you don't come to the room when the decision has already been made. That's very, very important, and that's one way we can push our institutions. I can share myself that I'm a troublemaker, a good troublemaker, in how I push my institution and in its understanding of why should we be doing this and why should we be involving certain people. My IT department hates to see me coming because I always hate when my emails from Nigeria or other countries get blocked. I ask them, what's the reason? What's really the reason? When you've seen me communicating with this person, why is this email being blocked? And so they really hate to see me coming because, whew, I am a troublemaker. I know that. So we're getting close to the end, but I did see someone had their hand raised. Last name looks like, or first name is Shimaka. I don't know if we're able to get that person to be heard. If they have a question. I saw the hand went away and it's come back again. Iken, I don't know if you can help me to unmute that person to be able to ask their question. And once again, it's 2:41 in the morning in Australia. We have tiny human presenters with us. I'm so grateful. Thank you so much for coming. Well, maybe this person has wanted to ask something but is not able. I see Kamal Ibrahim's hand is raised. Would you like to ask your question, Kamal? Are we able to get Kamal to be able to speak? Yes. And you can unmute yourself now.
Yes, he can go ahead and speak.
Go ahead. Go ahead, Kamal Ibrahim. You can speak now. Your microphone is off of mute. Let's hope network is not happening to this person.
There's also a question on the Q&A box. So
Yeah,
while
we
you
answered that
answer
one
that,
already. Yeah, we've answered that one already. While we're waiting to hear from Kamal, I have a question. You know, we've talked a lot about this idea that there's some unlearning that needs to happen, right? I wrote that down and made a highlight of what you said, Alia. I'm wondering if you all have suggestions of specific tools. Michelle, you shared the intervention mapping paper with us as an example, but are there other tools that you all have used to help you unlearn and relearn how to do this work of centering and valuing lived experience voices? Any tool suggestions or readings maybe that we should do?
I can start off if you like, Stephanie. We have a lot of tools, and as I said, at the Equip Network, we're actually working on a toolkit. So watch this space. And in fact, if anyone has any tools that they want to share with us, we would love to know. There was a paper that I was going to mention today. If I think that sometimes when we talk about co-production, as we've all said, sometimes it's sort of difficult to know where to start. One of the papers that I find is really useful, and I'm going to pop the link into the chat there, it's a paper by an Australian woman, actually. Her name is Tanya Pierce, and she did a really nice scope review looking at all the different sorts of things that co-production, what does that really mean? And she actually broke it down into 4 different stages of co-ideation, co-design, co-implementation, and co-evaluation. And I find that really a nice way of thinking about the different stages that we should be bringing lived experience people into for each of those ones. And I love that it starts with co-ideation. And I think that talks exactly to what John was saying before, is it has to be from the very beginning. And it's not even that, oh, we want you to design, some education or whatever it is. It's what do you need in order to, do whatever we need to do. And so it's really at that beginning point. There's also another different sort of tool which people might find useful, and I talked about Alison Metz before. So at the University of North Carolina, I think it is, but I'll find the link for that as well. There's a really nice guideline on equitable implementation, and it takes you through their 6 key themes for equitable implementation, but also gives a little bit of practical guidance around case studies. So yeah, that might also be helpful.
Can I ask you before I go on to John and Alia, there's a question in the Q&A box that is interesting and kind of ties to this idea of equity. In the United States right now, the word equity is a bad word. It's on the list. And so I'm wondering if, as you're giving us the examples of tools, if you could also share other terms maybe that you've used to describe equity without using the word equity. It's like it's a game.
It's a really good question, and I'm going to have to take that question on notice, I think. I'm not sure my brain at 2:45 in the morning is going to be very good at that. I must admit, in Australia, we don't have that same issue that is faced by researchers in United States, but definitely I know what the issue is. But I can see Ali has taken herself off mute, so I feel like she has some suggestions.
I don't have an answer per se, but I know in our lived experience space, our village network, we've done a lot of work around understanding what equity is, because it is really confusing.
Yeah.
But one of the pieces of work we did was it was called, we did an artwork project called The Voice of the Child. So we took these essential elements of equity and broke them down and invited children to create artworks that represented them. So the common theme that we got was we translated equity to fairness, because that was a really understandable and tangible term that anyone could actually access. And I put a link in the chat to our village network, but I'll just reshare it again, because on there we've got links to the Voice of the Child work that we've done, but we've also created a report from lived experience around how to authentically engage our voices in health and medical research. And we've also created some quite unique kind of workshops or conversations we can facilitate kind of globally on how to strengthen your individual practice. And we can take that to services as well. So our modelling is a little bit different in that it's come from the voice of lived experience around what do you actually need to strengthen that. And so I really understand the nuance of that American context around equity, but we just really found fairness was a really nice translatable way in Australia for everyone to understand it, because even we look at different definitions of equity and whose it is. So we just thought, what's a term we could couch it in that hopefully anyone could understand and feel a little bit more that they could access it.
Thank you. That's perfect. Dr. John, any tools that you have in mind that have helped you, and thoughts about other words we can use?
Okay, so thank you. I don't have any recommendation for any tools at the moment. But like I said earlier, she said fairness, just opportunity can be another phrase you can use for equity. It's just about, how do you ensure that opportunities is just for everyone that you're giving resources of these to? Thank you.
Thank you. So I'm going to ask us to take it home now. And I have a question for each of you to give us a take-home message for today. And Michelle, I'll start with you. So what's one practical step that all us researchers in the room can take immediately to make their project more genuinely co-produced rather than this token type participatory action that we've been discussing?
Thanks, Stephanie. And I know that I'm not going to talk for a long time but there's lots of things that we could do, and it's really difficult to choose one. I think if you're completely new to co-production and you're drawing up your next grant application or your project plan, I think it's really important to really explicitly put in your plan that you're going to consult with lived experience experts. And I don't think you need to go straight to maybe what we have in that Alia and I have described in our team. You don't have to have a village. You don't have to have an Alia who sits there and co-leads all your research. But, it's just almost making that first step is important, I think, and making that mental switch. I think we do have to recognize that it's really hard to change our normal habits and processes. So I think it's okay to just make small incremental steps. But also remember what that end game is and who we're serving. If you're already engaging in some co-production and just, already tinkering around the edges, a couple of things that you might want to think about is how do you receive the input from lived experience experts? So, for example, are you going out to their community and meeting people on the ground, meeting them in spaces where they feel comfortable and relaxed and safe? Are you giving them alternate options for connecting with you, as Alia suggested? You have to remember that places where we feel comfortable, maybe like hospitals or universities, or you're wearing your white coat, that is uncomfortable for other people and can really change the way that they interact with you. And I think that the other thing that I encourage you to do, and I guess this links back into Equip a little bit, is to think critically about how you're integrating the feedback you're receiving from lived experience experts. And we talked already about thinking critically about who you're receiving that from. But then seek out others who are doing similar work. I think that unfortunately it isn't common enough that we're all doing this. So start up a community of practice if you can. It's really helpful to learn from other people, and find out that it's not just you doing it, but there's other people and there's different ways that you can do it, and use that to optimize your work. And I have actually thought of another way of talking about equity, which I do talk about, and that's supporting those who need it the most.
Oh, that's good. That's good. Supporting those who need it the most. I'm gonna steal that if that's okay. Alia, I have a take-home question for you. If you could give one message directly to funders and policymakers in this room about lived experience, what would you say?
I think firstly, I'd want to say thank you. Thank you for a curiosity to understand the idea of this practice. I personally feel it is such a powerful way of working, and acknowledging that we're just a really rich knowledge base to be tapped into. I would encourage you to be curious and to be brave, to really question traditional structures and hierarchies. Why has a structure always been a certain way? When we look at creating policy and funding, why wouldn't we be using every available support to strengthen our research and practice? And that's what this is. I would also say that you don't have to do it alone. We've spoken about there's amazing starting points. We've got Equip, we've got the Village, we've got these places that, as you can tell, Michelle and I are here because it really matters to us. We're here because we want to be, because it's an immense privilege to be able to champion this practice. And we found such a richness in this combination of knowledges. And what my hope is that we can, that we found this ease of way of working, but also a strength of it. And I really just want to echo that I'm happy to continue to have these conversations, that, we're here to reach out to. Also acknowledging you'll probably have some really strong advocates geographically closer or more, project specific to where you are. But hopefully with a little bit of our sharing that we've made it feel a little bit more achievable, a little bit more tangible. But yeah, be curious, be brave. No, you don't have to do it alone. And just genuine thanks for acknowledging a change to such ingrained and traditional structures.
That's beautiful. Thank you so much. And Dr. John, what lessons from HIV programming in Nigeria do you think implementation scientists could borrow when designing equity-centered interventions in other health domains, like maybe palliative care, or like in my work, sickle cell or other non-communicable diseases?
Okay, thank you. So I think it's important, like we've said today, to ensure that the community should be involved as co-designers from the beginning, right? They should not be seen as just beneficiaries or recipients of the services. When communities are involved in shaping the decisions or the design of the program, they make lasting impact on the sustainability of the program as well as other things. So for me, I think first we should ensure that the communities are involved from the beginning, and they should be given a voice, right? Don't just involve them. Ensure that they are given the power and their voice is heard when you involve them. And I also think that one key thing that we've done in HIV that's significantly improved programming and ensure that we reach as many persons as possible is the decentralization, the differentiated service delivery. If we must do that for other disease entities, I can tell you, for either chronic or non-communicable disease, it will go a long way to ensure that we are able to reach as many persons as possible. That is really important too. And sometimes when we also sometimes when we design programs or we are trying to ensure that evidence-based interventions are carried forth, one of the things, a lot of times, they focus on just disease entities. Now, a single disease entity, just vertical programming and all that. But in actual fact, in communities, one of the things that will benefit them the most is if services are integrated, right? Because at the end of the day, the vulnerabilities and the issues that they suffer is not just vertical, So trying to integrate services in community is important, and I'm happy that, the US government begin to focus on that now, thinking integration instead of standalone interventions, So, and for researchers, implementation science researchers, I think if we think about this, it will go a long way to ensure that our research is translated into action and makes impact at the end of the day.
Yeah, this is wonderful, wonderful, wonderful. I just have to say thank you to all three of you for providing such a deep, deep dive and thought-provoking discussion. And I also want to thank our audience today for engaging and also providing us some insightful contributions and questions and making us all to think. I think from what we heard today, just it reinforces this idea that equity in implementation science really is not achieved just because of intention alone. It really does require us to think differently, to enact structural changes, like we were mentioning throughout this session, in how we define expertise, as has been discussed, the way we design our interventions, and even design our design for the intervention, okay? And it also has to do with how we share decision-making power and who is the decision-making power person, who has that power. A key theme, I think, that emerged throughout today is that lived experience is not a supplement to evidence, but in itself is evidence, okay? And then when it's meaningfully integrated, that is lived experience, it can reshape the way we ask our questions. It improves the relevance of an intervention. But then also, because all those things are working together, it strengthens our implementation outcomes. And so we've heard very clearly today that co-production is not a methodological option. It really is a commitment, a relationship. It is trust that must be supported by systems, our funding structures, and our institutional culture. So as we reflect on today's discussion, I would like us to leave here with three different challenges. So first, to our researchers, how do we ensure that our methods genuinely redistribute power rather than simply document inequity? And second, to the implementers and policymakers, how do we create systems where community voice is not heard after decisions are made, but before they are defined? And lastly, to our funders and institutions, how do we incentivize and sustain research models that meaningfully value lived experience? So with that, I want to say thank you, thank you, thank you, thank you, thank you. It's 3 a.m. in Australia. It is 6 p.m. in Nigeria. I want to say thank you so much to all of you for being here. And I want to invite all of us for tomorrow. We're not done yet. It is not done yet. We have one more day that is going to be action-packed with some heavy-hitting panelists. Tomorrow is action and accountability, making evidence stick, tools, strategies, and metrics that drive sustainable policy and practice change. We have the one and only Professor Emmanuel Pepra and our one and only Dr. Prosper Okonkwo that will be with us tomorrow. So if you've not registered, I don't know what you're doing. You need to register now. Please register now. And on that note, if you want more things like this, if you want your brain to percolate the way it's percolated today, if you want to cook up good ideas, there's only one place you should be in September, and that is the 11th annual NISA conference, happening the 2nd through the 4th of September in Abuja Continental Hotel. Please join us, for our theme this year is From Evidence to Impact, Advancing Implementation Science for Sustainable Development. And with that, I want to say thank you, everyone. And I hope that each and every one of you have gained something from our conversation today. Thank you to our panelists, Dr. Michelle Gouy. Thank you, Ms. Alia Griffiths and co-presenters. And I want to say thank you to Dr. John Oko today. Thank you so much for your time. Everyone, have a blessed day, and we will see you tomorrow. Bye-bye,
Thank you.
everybody.
Bye, everyone. Thank you.
I'll hang out here for just a second. I pushed the wrong button. Thank you, everyone.